Good evening, I'm Ian Hannamansing. Record COVID numbers in the prairies while parts of Ontario head back into lockdown. Toronto shoppers flock to stores before they close to the dismay of doctors.
We're going to see a wave for sure in a couple of weeks from that.
And business owners try to stay afloat.
The stress is virtually killing me.
Plus a concerning spike in the West.
It's clear that the measures that are currently being used are not enough.
And a Canadian exclusive interview with Barack Obama. Matt Galloway talks to him about President Trump, the relationship with Canada, and racism in the U.S.
Do you think Donald Trump is a racist?
I think I literally said I'm 90% sure it's my favorite game.
New audio suggests police knew the Nova Scotia shooter was disguised as an RCMP officer long before they told the public.
They failed to give the public the information they needed to stay safe.
This is The National. Across the country tonight, unease and urgency are creeping higher alongside COVID cases. And yet in Ontario, some people rushed to shop as two regions prepare to lock down tomorrow. One of them, Canada's biggest city, Toronto. In virtually every region, deepening concern about just how many people are getting sick with this virus. We'll have it all tonight. But we start with a Canadian exclusive interview, a conversation with former U.S. President Barack Obama about his country and ours. From a deeply divided United States exploding with COVID cases and politically polarized, he opens up to Matt Galloway, host of CBC Radio's The Current, about race, Donald Trump, and whether Canada's relationship with the U.S. can be mended.
Listen, you've got a president right now, he wants full credit for an economy that he inherited. He wants zero blame for the pandemic he ignored.
Former U.S. President Barack Obama isn't holding much back these days.
Tweeting at the TV doesn't fix things.
Taking direct aim at his successor, using words like incompetent and disinterested to describe Donald Trump's time in the Oval Office. In his new memoir, A Promised Land, Obama also saves a few pages to write about the time he publicly poked fun at Trump at the White House Correspondents' Dinner in 2011.
No one is happier, no one is prouder to put this birth certificate matter to rest than the Donald. And that's because he can finally get back to focusing on the issues that matter. Like, did we fake the moon landing?
Obama also goes on to write that for millions of Americans spooked by a black man in the White House, Trump promised an elixir for their racial anxiety.
Donald Trump was one of the leaders of the birther movement, painting you as a foreigner in the office of the president. Do you think Donald Trump is a racist?
I don't know what's in his mind and what's in his heart. What I can say is that his rhetoric has oftentimes tapped into themes that have been used in this country for years in order to block the full participation of African Americans in our country's lives. He is more than happy to fan racist sentiments, and that from anyone who has a public platform, much less the President of the United States, is a problem. And now is turbocharged in the internet, and we've seen an increase in those kinds of attitudes. This fear of the other, this suggestion that somehow there's real Americans and then there are people who I guess are fake Americans. And somehow the fake Americans tend to look like me.
And can you, if you're him, can you unleash that without being a racist? I mean, I just wonder whether it matters whether he's defined as a racist or whether he's just involved in what people
but that's my point.
Acts.
I guess that's my point, Matt. It doesn't really matter, right? I'm not interested in his motivations. I'm not interested in what's in his heart. I'm interested in what he does.
Let's talk about this country. You know Canada very well, and the last 4 years, I think it's fair to say, have seen the relationship between Ottawa and Washington take a real battering. Peter Navarro, the president's trade advisor, said there's a special place in hell for Justin Trudeau. Why, after the last 4 years, with trade wars, with tariffs being put on aluminum and pointy comments like that, why should Canadians trust the United States?
Well, look, Canada doesn't really have a choice, just like the United States doesn't have a choice. We share this massive border. We're our biggest, each other's biggest trading partners, and we have to get along in order to in order for our economies to function. Not to mention the fact that the people-to-people relations between our two countries are as close as any two countries on earth. I've got all these friends who I discover 10 years later that they were Canadian all along. Nobody told me.
We're everywhere.
You guys are sneaking around hidden among us. And I'll be honest with you, on my scale of worries in the aftermath of the Trump administration, the relationship between the United States and Canada is not at the top of the list. I think that is one that actually can be mended relatively quickly. I think we've got some bigger problems in terms of managing America's role internationally because we ceded a lot of that leadership, most recently on how we deal with the pandemic and recovering our credibility around basic things like science and our role in public health around the world. That's going to be a tough one to dig ourselves out of a hole on.
And so, Matt, the political climate in the United States right now seems so supercharged. Does Obama seem concerned about the direction his country's headed?
Absolutely. And I mean, there's that unspoken rule, I think, that the former president doesn't critique the person who ends up following him or her in the job. But he's been very explicit about this in our conversation and in the book, talking about the damage that he sees and the divide in the United States. 71+ million people voted for Donald Trump. And I asked him whether he could wrap his head around that. And he says it's incumbent on Republicans, but also all Americans, to try to figure that out. So he is really concerned. And it's about politics. It's about the international reputation of the United States and about the pandemic that's raging in the country right now.
So much ground to cover with Barack Obama. What will surprise people the most, do you think, about the conversation?
I think that he's willing to be reflective and talk about the fact that he came into this job with enormous expectations as the first black president, but also as somebody who a lot of people put their own hopes and dreams into. And he talks about the weight of those expectations and what happens when he let people down. He admits that he didn't get everything right. And I think that sense of reflection, that sense of self-criticism is surprising to me, and I think will surprise listeners and viewers as well.
All right. Fantastic, Matt. Thank you.
Ian, thank you.
Matt Galloway is the host of The Current on CBC Radio 1, and you can hear his full conversation with former President Barack Obama on Monday morning. The coronavirus has Canadians confronting hard choices tonight. As infections rise, so does anxiety. Ontario reporting 1,534 cases today after a record-breaking number yesterday. And tonight, Peel Region and the City of Toronto, together home to more than 4 million people, are heading into the strictest lockdown since spring. It's a desperate bid to reduce contacts and head off disaster at hospitals. But Angelina King shows us the immediate response from many people ahead of the lockdown was to rush to the mall.
The winter weather didn't stop Torontonians from stocking up before hunkering down, getting in last-minute shopping and errands.
I booked an appointment as soon as I heard there would be a lockdown.
To accommodate the demand, this spa extended its hours and brought in extra staff.
Our phones went off the hook. Essentially, we don't have a set closing time. It's whenever you need us, we're here.
But midnight tonight is a hard closing time, and it's not clear when they'll open again. To stay afloat, they're selling DIY spa kits and other at-home products.
We have to get ready to respond and pivot and do things differently in order to survive.
Other businesses are already on life support.
The stress is virtually killing me. It's very hard every day to wake up, get up.
Sabina Coulter's Brampton restaurant will try takeout for 2 weeks to see how sales go. But after spending thousands on safety measures inside and outfitting her patio outside, it might not be worth it.
I've already had days in November where we made $0.
Malls extended their hours for last-minute shoppers.
You got to do what you got to do to get it done.
We're getting our Christmas shopping done before the lockdown. I literally saw that like everything was closing. I was like, if I don't get it now, I'm in the doghouse.
But after seeing crowds like this, doctors have different worries.
We're going to see a wave for sure in a couple weeks from that.
Dr. Kashif Prasada says the ICU at his hospital is already full. He says the lockdown is critical, but that's just part of it.
I would say test every factory, every home in that area, couple it with sick leave benefits, and just try to find out where the hidden pockets of infection are.
This lockdown is in effect until at least December 21st, leaving many people here wondering if things will reopen in time for the holidays. Angelina King, CBC News, Toronto.
COVID-19 has been detected in about 1 in 7 Ontario schools. The vast majority are single cases or small clusters, but one school right now stands out. F.W. Begley Public School in Windsor now has 26 confirmed cases. It was closed on Tuesday after 3 cases emerged among staff. Not clear where they contracted the virus or how it spread in the school. Quebec reported 1,154 new cases today. That number actually reflecting a slight decline over the past week or so, though the province continues to lead the country in hospitalizations and deaths. For the first time since the earliest days of the pandemic, the highest one-day case total didn't come from Quebec or Ontario. It was Alberta, a province with a much smaller population. Alberta reported a record 1,584 new cases. Since November 1st, average daily new cases have doubled, and in Saskatchewan, they've tripled. Today, that province reported 236. Hotspots have spread across the West. A month ago, BC, Alberta, and the Prairies together accounted for about a quarter of the country's daily new cases. Now it's almost half. Austin Grabish is tracking the response.
He just liked making everybody laugh and put a smile on their face.
Teresa Eschuk is trying to put a face to the numbers. Her dad, Walter, died after testing positive for COVID. He's one of at least 46 residents from the Maples long-term care home who've died. Eschuk says he was so badly dehydrated, a paramedic had to give him an IV.
Where's the accountability by this government to ensure that our seniors are taken care of?
Manitoba still leads the provinces in new cases per capita. In the city of Steinbach, the test positivity rate is sky high at 40%. More Manitobans have died in the past week than over the last 7.5 months.
I'm asking you why you didn't move faster to protect the people of your province, sir.
Today, Premier Brian Pallister on the defensive.
We kept some of the most stringent restrictions of any province throughout the summer that we've been preparing. Our testing has quadrupled.
And after Alberta's record-breaking weekend, hundreds of people are in hospital with COVID. At least 60 are in the ICU.
The measures that are currently being used are not enough.
The situation in Saskatchewan also troubling.
We have been calling upon tighter measures now for 2 to 3 weeks. We cannot wait until we hit a higher number.
We're standing up for your rights, your rights.
From the small group of people in Winnipeg, a different message against restrictions. Eschuk is horrified.
I am sorry. You know, they're saying their fight is freedom of choice. Well, my dad didn't have a choice, did he?
She didn't get to say goodbye to her father in person.
I had to do my dad's funeral virtually. I wouldn't wish that on anybody.
She hopes by sharing his story, people might take precautions more seriously. Austin Grabish, CBC News, Winnipeg.
The Atlantic bubble has been widely praised for keeping that region's numbers low, but even it's starting to show signs of strain. New Brunswick posting 6 new cases today, and that is after setting a single-day record yesterday of 23. Nova Scotia reporting 11 new infections. And in the Halifax region, starting tomorrow, social gatherings will be limited to 5 people. Nunavut added to its caseload today with 21 new infections. That pushes its total number of active cases to 128. The territory started a 2-week lockdown several days ago. We all know COVID-19 has had a devastating impact on Canada's long-term care facilities. In British Columbia, there are currently more than 40 outbreaks in care homes. And as Briar Stewart explains, that's fueling a push for rapid testing.
This is how Nahar Sadhu has been communicating with his mother after a large outbreak of COVID-19 at her care home.
We used to be able to go inside and visit her before, but now it's can't go in there at all.
At last report, 2 people have died and more than 107 staff and residents have tested positive at Tabor Home. Fiona Whitson-Walsh's relative is one of them.
It's just shocking that this kind of an outbreak would still be happening now, 9 months.
And she says she has plenty of questions about what's going on inside the home.
What are their daily routines like? I can just imagine the smell. Like, I can just imagine what they're living through.
Back in March, BC recorded Canada's first death from COVID-19 at the Lynn Valley Care Home. Since then, the province has stepped up precautions, including restricting staff to working at a single facility. But despite that, there are now outbreaks at more than 40 long-term care homes in the province.
We are doing our hand washing, we're wearing proper PPE, and we're looking at ways in which this is spreading and trying to stop the spread altogether.
What would help, officials say, is if rapid testing was available so workers could be tested before each shift. The federal government has sent more than 3.8 million tests to provincial health authorities, but some jurisdictions, including BC, are still figuring out just where and when they should be used, in part because they're generally seen as less reliable than lab results. But BC's seniors advocate believes they would still be better than what's in place now.
If we had rapid testing, we might catch some of those people who actually are shedding the virus, but they're not showing any symptoms.
At Tabor Home, they're currently testing everyone once a week. And since the start of the outbreak, the number of those infected has just kept growing. Briar Stewart, CBC News, Abbotsford, BC.
Leaders of the world's biggest economies, including Justin Trudeau, promised this weekend to help developing nations get access to a vaccine. And while Canada has committed to that global approach, many here are also calling for a national strategy. Ashley Burke has the details.
That our joint efforts will soon bring us to a turning point in our fight against the coronavirus.
At an event forced online for the first time because of the pandemic, the response to the crisis was front and center. G20 leaders recommitted to helping developing countries through COVID, including with a vaccine.
Even as Canada secures record amounts of vaccines for ourselves, we're also ensuring that they're going to be available for the world's most vulnerable people.
Under our existing agreements, we expect to be receiving 6 million doses by March 31st.
But when those shipments arrive depends on when the vaccine is approved, and then the question remains, who gets them first?
For now, we don't have enough vaccines for all of Canadians, and so we're going to start by vaccinating the most vulnerable.
It's up to provinces and territories to hammer out the logistics. Manitoba's premier wants a consistent approach across the country.
We need a national criteria established that is the same from PEI right to Nunavut.
Do you have a fever today?
No. Any approach will look different from the last major immunization efforts 11 years ago for H1N1. In 2009, millions lined up for the shot. 40% of Canadians were vaccinated within 5 months.
The fact that we're not going to be able to do a mass vaccination campaign like when we were doing for H1N1, for instance, because then, putting people together increases the risk of spreading COVID.
Quash Tan says that even when a vaccine is approved, Canadians will still have to wear masks and physically distance for at least another year or so. That's how long it could take to vaccinate the bulk of the population if 2 doses are necessary. Ashley Burke, CBC News, Ottawa.
As we often do, let's turn to Dr. Isaac Bogosh, an infectious disease specialist with the University Health Network in Toronto. And Dr. Bogosh, when that first group of people get the vaccine in long-term care, for example, what will the impact be on the wider population?
Certainly, that'll be a tremendous effort and will have a huge positive effect. We know, for example, people in long-term care account for about 80% of the deaths in Canada, so it will protect the most vulnerable of our vulnerable populations. But it will also have a pretty impressive spillover effect. We know for the vaccine to reach levels of herd immunity in a community, we'll need about 60 or 70% of the people to be vaccinated. We're not going to get anywhere close to that with the first wave of vaccines. But by helping protect the most vulnerable populations, we'll save lives. And it'll also take a lot of pressure off of the healthcare system as well. So I think that's a very important point, such that we don't start to get into scenarios where we're reaching or exceeding healthcare capacity like we're doing in much of the country right now.
You know, I'm already hearing from people who say they're a little hesitant about being among the first to take the vaccine. How will you try to reassure your patients?
I really think that we need some good education and transparent communication about what these vaccines do, how they were tested, the trial results, the fact that tens and tens and tens of thousands of people have had them, and just really discuss in a very clear and open manner what we can expect and what we can't expect, and just have a very transparent conversation about what these are. And I think with some information and actually listening to what people's concerns are and addressing those, I think we can sway a lot of people who might be on the fence about this.
As always, great advice, Dr. Bogoch. Thank you.
My pleasure.
Meanwhile, a powerful photo shared by Alberta Health Services has gone viral over the weekend. A doctor calling a family to tell them their loved one has died. One of 11 people reported that day to have died of COVID in the province. CBC News spoke with the doctor about speaking to the families, and here's what he had to say.
Every patient is different. Sometimes for reasons that you don't quite understand, you get more emotionally attached to one and it hits you harder. But we still need to protect ourselves emotionally because we want to deliver the best care possible. And after a phone call like this, you still need to care for the other patients that are not doing so well. So I would say, yes, I do get emotionally affected sometimes, but we work in very good teams.
CBC News has learned new details about last April's deadly shooting in Nova Scotia.
They failed to give the public the information they needed to stay safe. They failed at that.
Up next, what the RCMP knew during those critical hours. The Fifth Estate investigates. Plus, what you need to know if you fall victim to a money scam.
You keep your money in the bank because you think it's safe, and they treat the money like it's theirs.
An Ontario man goes public with his story. And later, spreading holiday cheer to children in hospital.
I hope this will make them feel amazing.
A pandemic gift in a box. We'll be right back. Now to a pair of CBC News investigations. The first involves new information about the Nova Scotia shootings last April, a crime which left 22 people dead. In its season premiere, The Fifth Estate reveals when the RCMP first learned critical details about the gunman, details some families believe could have saved their loved ones. Here's Gillian Finley.
The shooter was dressed as an RCMP officer and drove a replica car. Two of the very few facts the RCMP has shared in the aftermath of the shooting. At the time, police say they didn't learn that information until early Sunday morning, by which point 13 Nova Scotians were dead.
Prior to that time, we did not have all those details. The bulk of the details about our suspect came to us at that time.
But the Fifth Estate has obtained an audio tape that reveals the RCMP had the key details at least 8 hours earlier. They came from a witness who'd been injured by the man doing the shooting, Gabriel Wortman.
I think I literally said, I'm 90% sure it's my neighbor Gabe.
The witness wouldn't speak to us, but he did record this interview with a private investigator explaining what he told police.
And he had an RCMP officer, or RCMP car. I knew he had those cars, but I'd never seen them badged.
That was at 10:30 Saturday night. And yet it wasn't until 10:17 the next morning that the RCMP shared the information with the public in a tweet.
I've gone over and over and over again. They didn't release that he was dressed as an officer or in a marked cruiser. If the RCMP had have armed us with the information of who he was and what they knew by 11 o'clock Saturday night, she wouldn't even been on the road.
Beaton's wife, Kristen, a community health care worker, was shot on this country road just after 10 o'clock Sunday morning. A few minutes later, so was Heather O'Brien. Would that have made a difference if that information had been known to your mom, do you think?
I think it would have made a difference for my mother. I think it would have made a difference for Lillian Hislop and Kristen Beaton, Joey Weber.
Because why?
Gina Goulet. They failed to give the public the information they needed to stay safe. They failed at that.
7 months later, the families of 21 victims are suing the RCMP and the province for negligence. A public inquiry has been promised, but it's expected to take at least 2 years. And in the meantime, the RCMP refuses to answer questions. Gillian Finley, CBC News, Portapique, Nova Scotia.
And you can catch Gillian's full investigation of the Nova Scotia shootings on the season premiere of The Fifth Estate. That's tomorrow night on CBC Television and GEM. Scammers have been busy during the pandemic, often targeting job hunters. One victim decided to go public not because he lost money in a job scam. He's upset about how his bank handled the situation. Diane Buckner has that story.
Justin Smith was delighted to receive a job offer from grocery chain Sobeys and a check for close to $3,500 to buy home office equipment.
They gave me a real invoice, and they asked me to send them the funds via email transfer after they gave me a check that they said was pre-authorized.
He deposited the check to his account at Tangerine, a Scotiabank subsidiary, and sent $3,000 to the equipment supplier. But when he was told to send more money for a desk, he started to get nervous. The whole thing was a scam.
I called up Tangerine, and I said, okay, I deposited a check yesterday. You guys let me send the money. I'm concerned that this check is going to bounce.
Smith was right. There was no job offer from Sobeys. The website where he'd applied, the hiring manager, the check, all fakes. And when the check bounced, Tangerine took over $3,000 from Smith's tax-free savings account to recover its loss.
You know, you keep your money in the bank because you think it's safe. And they treat the money like it's theirs. And they just move it around like to protect themselves. That's not fair.
Because his TFSA was registered with the federal government, Smith assumed the money in it couldn't be touched. He was wrong. Agreements between banks and their customers can include a clause called the right of offset. It means a bank has the legal right to offset losses you cause them by dipping into your other accounts.
It's actually very common, and it's something people aren't aware of.
This credit expert has seen the right of offset used thousands of times.
In the fine print somewhere it said, hey, if you've got money at the bank and you don't pay us, then we can go into your bank account, or your TFSA and take money out.
After being contacted by GoPublic, Tangerine now says it will give back Smith's money and pay for a credit monitoring service for him.
I don't want to make myself out to be a victim here. I'm just trying to help other people not become a victim of these scammers, or quite frankly, become a victim of their bank.
Diane Buckner, CBC News, Toronto.
When we come back, why some Canadians are avoiding the emergency room and what this means for those who actually need care. Plus, planning for a pandemic Christmas, how Canada Post is adapting for a holiday rush like no other. A major consequence of the pandemic has been the impact on Canadian hospitals. COVID-19 patients may be flooding emergency rooms, but visits for everything else, heart attacks, strokes, and other kinds of emergencies are down. And as Vic Adopi explains, that's not necessarily a good thing.
When Peter McMillan gets short of breath, it's frightening.
It's like you're drowning.
It happened on Wednesday in a parking garage.
I'm told to call 911 because I really couldn't breathe. I'm going to put this on. Excuse me.
McMillan has avoided going to hospital emergency rooms because his lung disease makes him highly susceptible to COVID-19.
If you don't have it going in, you're going to get it there. It's the big concern.
His hospital hesitancy may explain why, when lockdown measures began in March, emergency room visits plunged compared to the same period last year. Of the most severe types of emergencies, there were 31% fewer visits for breathing problems, 23% fewer visits for chest pains and cardiac problems, and a drop in serious digestive disorders by 32%. In total, emergency room visits declined by almost 1 million compared to the year before. Some Canadian hospitals have seen sudden drops in ER cases in other public health crises.
And those decreases lasted up to 6 months after the initial onset of SARS. So they saw a bit of a continuation and it took a year to come back. But these are quite dramatic and they are across the country.
The one silver lining for hospitals, quieter ERs gave staff more time to adopt new infection control measures to prevent the spread of COVID-19 in hospitals. Still, questions remain about all those patients who may have needed emergency care but didn't get it.
So the thing that worries me the most is the truly sick that needed to be in the emergency department, that were not necessarily presenting, and that as far as we know, those are diseases that will still manifest themselves.
As for Peter McMillan, he worries about the next time he needs to go to emergency.
You get it and you die, the respirator and bingo.
Vic Adopia, CBC News, Toronto.
COVID-19 has led to a surge of parcels, a sign the pandemic has changed holiday shopping. Valeria Corey-Minocchio shows us the implications for businesses and the mail itself.
Marie-Ève Trudel will be doing this a lot over the next few weeks. She's been delivering a skyrocketing number of parcels.
Ça va être très exigeant. La période qui s'en vient, ça a été déjà très exigeant.
She says the upcoming holiday period is going to be very demanding. This year has already been busy. Canada Post is ramping up to meet that increased demand, adding more than 1,000 vehicles to its fleet and hiring more than 4,000 temporary staff.
We are hiring right across the country and in towns big and small, just because we need the extra help this year. We know it's going to be extremely busy.
There will be weekend delivery, spots for more parcel pickups, and extended post office hours at many locations. But Canada Post is still asking people to shop and send early.
The more you can spread out the demand, the better it'll be for anyone in the delivery business.
Some shoppers have planned ahead.
We actually started shopping in the summer online because we knew the pandemic was going to be around for a while. So we've slowly been buying things.
Reed says she's trying to be more conscious about where she shops.
Anything but Amazon.
Anything but Amazon.
The Canadian Federation of Independent Business is encouraging consumers to buy local. It's set up a site showing how shoppers can support local businesses in their communities. But pandemic shopping habits may be here to stay, forcing small businesses to adapt.
There are three things that businesses have to contemplate. Number one is ensuring that they have an e-commerce platform that works. Number two, they have to consider delivery options. And number three, they have to start thinking about promotional activities that they could use online that will attract the local consumer.
As for Trudel, she knows she's got a packed few weeks ahead, trying to deliver for a holiday season unlike any other. Valeria Corey-Minocchio, CBC News, Montreal.
In the U.S., this week is busy for another reason, Thanksgiving. But this year, families are being urged to forego the get-togethers to prevent the spread of coronavirus. And spreading it is. Today, at least 152,000 more people tested positive. Donald Trump won't be leaving the White House for the holiday as he continues his court fight for another term. Here's Paul Hunter.
From the monster lineups for COVID testing, this one's in Los Angeles this weekend, to the ever closer to capacity hospitals where COVID is again spiking in America, the fear of the moment is a looming collective potential super spreader. The countless family get-togethers for this week's U.S. Thanksgiving.
You see people traveling, you see the clips on TV, people's at airports. I mean, those are the things we've got to realize are going to get us into even more trouble than we're in right now.
But even as COVID experts all but beg Americans to be extra vigilant at airports and the dinner table, there's pushback.
When you're in the majority, you have the vote.
Consider this yesterday in Washington state, a protest against restrictions on holiday gatherings.
We're being manipulated, and it's up to us to say we're not taking it no more. We're going to have Thanksgiving with our family, and you're not going to tell us otherwise.
Meanwhile, as America braces, the president again today went golfing, as his lawyers kept up that other battle, Trump's efforts to reverse the outcome of this month's election. Increasingly, even high-profile Republicans now urge the president to give up and just plain move on.
The president's legal team has been a national embarrassment.
From the former Republican governor of New Jersey, Chris Christie, to the current Republican governor of Maryland, Larry Hogan.
It's time for them to stop the nonsense. It just gets more bizarre every single day.
And yet, Trump's lawyers keep at it. In another courtroom loss yesterday, a judge in Pennsylvania ruled the case was, quote, without merit, speculative, and unsupported by evidence. Today, the Trump campaign filed an appeal regardless. Paul Hunter, CBC News, Washington.
Up next, a CBC Sports investigation into fraud in youth sports leagues.
We don't tend to think that Joe down the street, who's the treasurer for a hockey club, might embezzle funds.
We look at how widespread these crimes are and what makes these organizations vulnerable.
I'm Jamie Poisson, and tomorrow on CBC's daily news podcast, Front Burner, Canada's total debt is expected to hit $1.2 trillion next year. A look at a controversial economic theory that says all the worry about money spent is misplaced. Subscribe wherever you get your podcasts.
Welcome back. A CBC Sports investigation into Canada's billion-dollar youth sports industry has revealed that some organizations across the country are losing millions of dollars to fraud and theft. Jamie Strachan has the details, including the impact that's had in the communities.
Picturesque community of Corner Brook, Newfoundland, hockey is a way of life. The local arena, home to the Corner Brook Minor Hockey Association, is the bustling hub of the coastal city. But for a while, after money went missing from the Hockey Association, the future of the game was in jeopardy.
The money that was gone missing was essentially, money that came from parents, hardworking parents in the community. Money they had thought was for the enjoyment of their children playing hockey.
Darren Harview is the association's new treasurer, brought in after the former treasurer allegedly stole $80,000. The news hit the community hard. Harview says the damage ran much deeper than just the missing money.
It's very unfortunate, especially when you have a hockey community and everyone's involved in the hockey community. It's very disappointing when you come to the realization what you're facing in terms of what happened.
At around the same time, halfway across the country, details of a much larger case were emerging. The Ontario Minor Hockey Association oversees 225 local associations and about 300,000 players. It's not a volunteer organization, but run by paid professionals. According to court documents obtained by CBC, the association's director of finance stole nearly $2.4 million over a 6-month period to support an online shopping and gambling addiction. It's by far the most money ever stolen from a North American youth sports organization. League officials only found out about the theft when the employee confessed. She has pleaded guilty to 1 count of fraud over $5,000 and is awaiting sentencing.
We tend to trust our neighbors. We tend to trust the parents that are in these leadership roles within our sport clubs.
The University of Waterloo's Katie Meisner is one of a handful of academics exploring the crime of youth sports fraud. She says a number of factors make these organizations vulnerable. In most cases, money is handled by a single trusted person who knows the association's financial ins and outs.
They're great people, and they contribute a lot of time and their own resources to those roles, helping kids be active and running the club. So we don't tend to think that Joe down the street, who's the treasurer for a hockey club, might embezzle funds.
Every year, hundreds of thousands of parents sign their children up for countless activities, like soccer, baseball, or gymnastics. These registrations represent hopes of physical fitness, life lessons, and success on the field. Parents are also pouring millions of dollars in fees into the coffers of youth sport leagues and associations.
Most parents involved in youth sports don't think that this is possible.
Eric Carosa is the founder of the Center for Fraud Prevention, an organization that helps youth sport organizations reduce the risk of theft.
In most cases, the community is shocked to learn that somebody would be embezzling from children in their sports program. However, knowing what I know about these organizations, it doesn't surprise me at all. They all tend to operate with a lack of governance and a lack of oversight.
A CBC Sports investigation found that in the last decade alone, nearly $8 million has been stolen or has gone missing from dozens of youth leagues and associations in nearly every province. $227,000 from a baseball league in Coquitlam, BC, $45,000 from a girls' hockey league in Woodstock, Ontario, and $53,000 from a hockey association in Grand Bank, Newfoundland.
My initial reaction was, how did that happen?
In the Ontario Minor Hockey Association case, Murray Taylor says many questions remain unanswered. Taylor is a lifelong coach and past president of the Newmarket Minor Hockey Association, an OMHA member.
I would have liked to have seen a lot more transparency. I mean, they are victims. And instead of just trying to pretend it didn't happen, I don't see the problem in saying, you know what, this happened. These are the things we've learned from it.
The OMHA's audited statements show much of the stolen money was recovered through insurance. Murray says that's besides the point.
This put a lot of kids at risk. And they put a lot of the programming at risk. Minor hockey associations are not for profits. We are a zero-sum game. You know, nobody's making profits on this. And if they hadn't had that insurance, this could have really impacted a lot of hockey programs negatively.
The Ontario Minor Hockey Association has communicated very little to the thousands of families it represents about how it lost millions of dollars. The OMHA also refused our repeated requests for an interview, telling CBC in a statement it didn't want to affect the upcoming sentencing hearing. Carrozza says instances of adults taking money from youth sports is far more prevalent than what's reported. For a number of reasons, he says leagues don't report stolen money.
There's a reluctance on the board to file criminal charges because it's really their responsibility for the financial governance of the organization. And so in many regards, they're culpable for allowing this to happen.
Carrozza also says that even if parents suspect somebody is crossing the line, few press the issue.
I've seen parents who try and challenge organizations and ask questions, and what they're worried about is their children are going to be retaliated and maybe either get removed from the organization, asked to leave, or not make one of those important travel teams that they're hoping to make.
Back in Corner Brook, a different approach.
I think the most important thing for us was to be transparent with the parents, the community, creditors, basically anyone who had a question. We wanted to be able to answer it on the spot.
Through intensive fundraising and cost cutting, the community has rallied together. The league's debts have been paid off, and the way it does business has changed.
There was no one single person that would be involved in whether it be the banking, the cash handling, paying employees. It's always a team approach. So I think that's what sort of gained the trust back with the hockey community, was just to make sure that, you know, there's always people watching.
Harview acknowledges rebuilding that trust will take time, but at least the focus is now back on the ice. Jamie Strachan, CBC News, Toronto.
Still ahead, acts of kindness fit for this difficult time.
It's not just a box of toys, I always say. It may look like that, but it's a box of hope.
How a mother-daughter duo is giving back this holiday season. That's next in our moment. One item at a time, boxes are being filled with toys and joy in Toronto for kids spending the holidays in hospital. In COVID times, we'll take all the good news we can get, and this definitely fits the bill. It's a tradition built on a simple gesture that meant a lot to one former patient. How her family is paying that forward is tonight's moment.
When Sophia was battling cancer at the end of her journey, we were at Sick Kids Hospital and she was gifted a pack of stickers from a custodian. And it was just a little pack of stickers, but it brightened up her visit. So during that following Christmas, we thought, why don't we do something and give back to the children who are still in the hospital? And we started off with a little brown box, and it's grown over the 4 years into this beautiful box full of love.
It's really important, so it cheers them up and gives them something to do. Because just thinking about making a kid happy makes me feel happy.
We were worried with the pandemic, but we didn't want to stop. We know that there's kids that are still sick, they still need to be uplifted, and the community still came together, and it's wonderful.
I hope this will make them feel amazing, and I hope it'll really cheer them up.
How can that not make you feel amazing? They have filled 10,000 boxes, and a lot of the recipients have written thank you notes and inspirational stories. You can go to Super Sophia Project and see that on their website. Sophia, by the way, is cancer-free. What a nice way to end the program. That is the National for November the 22nd. Good night.